Welcome to Health 999, your trusted source for simple yet essential health knowledge. Today, we're going to explore the top 10 warning signs of herniated discs in older adults and the most effective ways to manage them. Listen carefully, because a small sign today could be the key to preventing chronic pain tomorrow. Sign number 1. Persistent lower back pain. One of the most common and early signs of a herniated disc in older adults is persistent lower back pain. This isn't just the occasional soreness that comes after a long day or lifting something heavy. It's a deep, nagging discomfort that doesn't seem to go away. You might notice the pain is always there, whether you're sitting, standing, or lying down. For some, it may feel like a dull ache, while for others, it could be a sharp or burning sensation. What makes this kind of back pain different is its duration and resistance to typical over-the-counter pain relievers. If the discomfort lasts more than a few weeks and begins to interfere with your daily routine, like walking, sleeping, or even getting dressed, it may be more than just muscle strain. This type of pain often stems from the pressure a herniated disc places on surrounding nerves and spinal structures. Left untreated, it can worsen over time, potentially leading to complications like nerve damage or limited mobility. That's why it's important not to ignore chronic back pain, especially as we age. Early evaluation by a healthcare professional can help identify the root cause and set you on the path to proper treatment. Sign number 2. Pain that radiates down the leg or arm. One of the most common and telling symptoms of a herniated disc in older adults is pain that radiates down either the leg or the arm, depending on where the herniation occurs. This pain is often described as sharp, burning, or shooting, and it typically follows the path of the affected nerve. When a disc in the lower back presses on the sciatic nerve, it causes pain that travels from the lower back, through the buttocks, and down the back of the leg. This is known as sciatica. If the herniation is in the neck area, the pain may radiate down the shoulder and arm. This kind of nerve pain is different from muscle soreness. It often worsens with certain movements, such as bending, sitting for long periods, or even coughing. Some people also report a tingling sensation or numbness in the same area. If you're experiencing this kind of radiating pain, especially if it's persistent or worsening, it's important not to ignore it. Early evaluation by a healthcare professional can help prevent long-term nerve damage and improve your chances of a full recovery. Sign number 3. Numbness or tingling sensations. One of the most common, yet often overlooked, symptoms of a herniated disc in older adults is a persistent feeling of numbness or tingling. This sensation can feel like pins and needles, a light buzzing, or even a gentle burning in your arms, legs, fingers, or toes. It usually occurs when the herniated disc presses on nearby spinal nerves, disrupting the normal signals that travel between your brain and body. For many, this numbness may come and go. It might start in one specific area, like the back of your leg, your calf, or the sole of your foot, and slowly spread over time. You may also notice that the affected area feels asleep or lacks sensitivity to touch, heat, or cold. If you experience numbness or tingling that lasts more than a few days, especially when combined with back pain, don't ignore it. It could be your body's way of warning you that something more serious is happening in your spine. Early detection can make a big difference in treatment options and long-term outcomes. Always consult a healthcare provider for a proper diagnosis and care plan tailored to your needs. Sign number 4. Gradual muscle weakness. One of the most overlooked yet serious signs of a herniated disc is muscle weakness that develops over time. This usually happens when the bulging disc compresses nearby spinal nerves, interrupting the signals between your brain and muscles. As a result, certain muscle groups, especially in the arms, legs, or lower back, may start to feel weaker, even during basic activities. You may notice it's harder to lift everyday objects, climb stairs, or maintain your balance. Some people describe a feeling of heaviness in one leg, or a dragging sensation while walking. Others may experience grip weakness, making it difficult to hold onto items securely. This kind of muscle weakness doesn't usually happen overnight. It comes on slowly, and if left untreated, it can lead to long-term muscle atrophy or even permanent nerve damage. That's why it's crucial not to ignore it. If you or a loved one begins to feel weaker in one limb or side of the body, especially when accompanied by back pain or numbness, it's time to consult a medical professional. Early intervention can help reverse the damage and restore strength before it becomes a lasting issue. Sign number 5. Increased pain when coughing or sneezing. One of the more surprising, yet important warning signs of a herniated disc is a sharp increase in pain when you cough, sneeze, or even laugh hard. You might wonder, what does sneezing have to do with your spine? The answer lies in the pressure inside your body. When you cough or sneeze, your body experiences a sudden spike in intra-abdominal pressure. This force pushes against the spine and, if there's a herniated disc, that pressure can cause the bulging disc to press even harder against nearby nerves. The result? A quick, stabbing, or shooting pain that radiates down your back or even into your legs. This kind of pain is a strong indicator that the issue is not just a muscle strain. It could be a spinal disc problem that needs medical attention. If you notice this pain happening repeatedly, especially when paired with other symptoms like numbness or leg weakness, don't ignore it. Your body is trying to tell you something. Listen closely, because early awareness can mean faster recovery. Sign number 6. Loss of flexibility in the spine. One of the early warning signs of a herniated disc in older adults is a noticeable loss of flexibility in the spine. You may find it harder to bend down, twist your torso, or even turn your head comfortably. Simple movements that used to feel natural, like tying your shoes, getting out of bed, or looking over your shoulder, can suddenly become difficult or painful. This stiffness often comes from inflammation around the spinal discs or from nerve compression, making the back muscles tighten up as a protective response. Many people ignore this symptom, thinking it's just part of getting older. But if your back starts to feel unusually rigid, especially first thing in the morning or after sitting for a long time, it could be more than just aging. It might be a sign of disc problems. Loss of spinal flexibility can slowly limit your mobility, reduce your quality of life, and even lead to poor posture or balance issues. If you notice these changes, don't wait. Talk to a healthcare provider. Early diagnosis can lead to better outcomes and help you stay active and independent longer. Sign number 7. Increased pain when sitting for long periods. One of the common signs of a herniated disc is increased pain when sitting for long periods. Specifically, if you have to remain seated for extended periods, such as when working, driving, or watching TV, you may notice your back starting to ache or feel numb. When sitting for a long time, the pressure on the discs in your spine increases, particularly in the lower back. This pressure can cause the discs to compress, leading to pain or numbness in the lower limbs. If you already have a herniated disc, you'll feel more intense discomfort when sitting due to the added pressure on the affected area. The pain may last anywhere from a few minutes to several hours after standing up. A simple tip to alleviate this pain is to change your posture frequently, stand up and walk around, or perform gentle stretching exercises. If the pain persists or becomes more severe, it's advisable to consult a doctor for an appropriate treatment plan. Don't let prolonged sitting negatively impact your quality of life. Sign number 8. Loss of bladder or bowel control. One of the more severe signs of a herniated disc, particularly when the disc compresses the nerves controlling the bladder and bowel functions, is the loss of control over these functions. This is a symptom that requires immediate medical attention. As untreated, it can lead to long-term issues with urination and defecation, significantly affecting the quality of life. Loss of bladder control, urinary incontinence, or bowel control, inability to control bowel movements, either diarrhea or constipation, can occur when pressure is placed on the nerves responsible for these functions. This condition may also be accompanied by weakness or numbness in the lower body. If you experience this, it's a clear sign that you need to seek medical care immediately. A doctor may recommend imaging tests such as an MRI or CT scan to determine the extent of disc damage and to develop an appropriate treatment plan, which may include medication, physical therapy, or surgery if necessary. Sign number 9. Severe pain at night. Back pain or pain related to a herniated disc can become more intense at night, especially when lying down to rest. This is one of the key warning signs of a herniated disc, as when you lie down, the pressure on the discs can change, leading to increased compression on the nerves. This can make the pain worse and disrupt sleep. Nighttime pain can present in various ways, such as sharp, dull, or radiating pain down the legs or arms, depending on the location of the herniated disc. Patients often feel unable to find a comfortable sleeping position and may wake up in the middle of the night due to severe pain. This not only affects the quality of sleep, but also hampers the body's ability to recover. If you experience this type of pain at night, it's important to consult a doctor for an accurate diagnosis and timely treatment. Regularly changing sleeping positions and using pain relief methods such as heat or cold packs can help alleviate the condition. Sign number 10. Pain not responding to common painkillers. One of the important signs of a herniated disc is when the pain does not respond to common painkillers, such as paracetamol or ibuprofen. This could indicate that the herniated disc condition is becoming more severe, with the discs being damaged or compressing nerves, causing intense, persistent pain that is hard to control. When you use regular pain medications but still can't alleviate the pain, it can be worrying, and you might feel uncertain about what to do. In this case, don't hesitate to seek help from a specialist. Your doctor may prescribe stronger pain medications, such as opioids or more potent anti-inflammatory drugs, and may also suggest other treatment methods like steroid injections, physical therapy, or even surgery in some severe cases. When the pain doesn't subside, delaying medical attention can worsen the condition. So, make sure to consult your doctor to have an appropriate and timely treatment plan in place. Safe and effective handling methods. 1. See a specialist in orthopedics or spinal neurology. When dealing with suspected herniated discs, it is crucial to consult a medical professional, such as an orthopedic specialist or a spinal neurologist, for an accurate diagnosis. These specialists are trained to identify the underlying causes of back pain and can evaluate whether a herniated disc is the source of the issue. They typically start by reviewing your medical history, performing a physical examination, and conducting tests to assess your reflexes, muscle strength, and the range of motion in your spine. Imaging tests, such as an X-ray, MRI, magnetic resonance imaging, or CT scan, may be ordered to obtain a clearer view of the spinal discs and confirm the presence of a herniated disc. These diagnostic tools are crucial in determining the extent of the damage and understanding the specific nerves that may be affected. Based on the findings, the specialist will recommend the best course of treatment, which could range from non-invasive methods like physical therapy or medication to more advanced options such as injections or surgery if needed. Seeing a specialist early can prevent the problem from worsening and help you avoid unnecessary long-term pain. 2. Resting properly, avoiding prolonged bed rest. When experiencing pain from a herniated disc, it is important to rest to help the body recover. However, resting does not mean lying completely still all day. Staying in bed too long can cause muscles to weaken, putting additional pressure on the spine and making the pain worse. Instead of staying immobile, you should rest properly. For example, lying on your side with a pillow between your knees to reduce strain on the lower back. Make time to move gently throughout the day, such as walking around the house or doing light stretching exercises. This helps maintain spinal flexibility, reduces muscle stiffness, and prevents other long-term issues. Additionally, proper rest improves blood circulation and enhances the body's natural healing process. However, if you experience severe pain, consult with a doctor to receive appropriate advice on safe rest and activity levels. 3. Regular physical therapy exercises. Regular physical therapy is one of the most important methods for treating herniated discs, especially in older adults. These exercises not only help reduce pain but also improve flexibility and strength in the spine, aiding the recovery process. One of the biggest benefits of physical therapy is that it helps strengthen the muscles around the spine, reducing pressure on the discs and preventing nerve compression. For the best results, patients should perform these exercises under the guidance of a physical therapist. The exercises typically include stretching, strengthening, and posture improvement, which helps reduce pain and enhance mobility. Additionally, regular physical therapy helps maintain spinal flexibility, decreasing the risk of recurring back pain. Most importantly, consistent physical therapy allows patients to maintain an active lifestyle, improves their quality of life, and reduces the need for long-term pain medications. 4. Using heat and cold therapy. Using heat and cold therapy is one of the most effective and easy-to-implement methods for relieving pain and inflammation caused by a herniated disc, especially for older adults. Both methods help reduce pain, relax muscles, and improve blood circulation. Cold therapy, applied in cases of acute pain or when inflammation is present. Cold temperatures help reduce swelling, numb the nerves, and decrease inflammation. You can use an ice pack wrapped in a soft towel and apply it to the painful area for about 15 to 20 minutes. Be sure not to place the ice directly on the skin to avoid frostbite. Heat therapy, ideal for chronic pain or when muscles feel tight. Heat helps relax muscles, reduce pain, and enhance blood circulation to the affected area. You can use a heating pad or take a warm bath. Apply heat for about 15 to 20 minutes, and avoid using excessively high temperatures to prevent skin damage. It's important to use heat and cold therapy correctly and not overuse it. If the pain persists or worsens, it's best to consult a doctor. 5. Adjusting your posture when sitting, sleeping, and working. One of the most important factors in protecting your spine and minimizing the effects of herniated discs is adjusting your posture. Our spine is designed to maintain a natural curve, and keeping good posture helps prevent unnecessary pressure on the discs. When sitting, ensure that your back is straight and your feet are flat on the floor, avoiding slouching or sitting in one position for too long. Your work chair should provide lumbar support, and if possible, place a small cushion in the lower back area to maintain the natural curve of your spine. When sleeping, choose a firm mattress that is appropriate for your body. A mattress that is too soft can cause your spine to become misaligned, while one that is too hard may cause discomfort. Try sleeping on your side with a pillow between your knees to reduce pressure on your spine. Avoid sleeping on your stomach, as this position can twist your neck and back unnaturally. When working, especially at a computer, be sure to adjust your chair and desk height so that the screen is at eye level and your arms form a right angle. Changing your posture regularly while working will help relieve stress on the spine, prevent pain, and maintain long-term health. 6. Lose weight if necessary. Losing weight is an important factor in reducing pressure on the spine, especially for those with herniated discs. Excess weight increases pressure on the discs and joints, causing damage and inflammation. This can make the condition of a herniated disc worse, leading to pain and limited mobility. If you are overweight or obese, losing weight can significantly improve the condition of your herniated disc. Each kilogram lost can reduce the pressure on your spine, helping to alleviate pain and improve mobility. Adopting a healthy diet, rich in fiber, fruits, and vegetables, combined with regular exercise, will help you lose weight safely and effectively. Exercise activities such as walking, swimming, or cycling are great choices for burning calories without putting additional stress on your spine. However, it's important to consult with your doctor before starting any weight loss or exercise program, especially if you have joint or bone issues. Losing weight not only helps you feel lighter but also protects your spinal health. 7. If necessary, intervention with medication, pain injections, or surgery may be considered. When conservative treatments do not provide relief, doctors may recommend stronger interventions to reduce pain and improve quality of life. Pain medication is commonly used to manage both acute and chronic pain. Drugs like NSAIDs, nonsteroidal anti-inflammatory drugs, or acetaminophen can help reduce pain and inflammation, providing relief during treatment. In cases of severe pain that does not respond to oral medications, doctors may suggest pain injections directly into the affected area, such as steroid injections into the spine. This method can quickly and effectively reduce inflammation and pain, especially for those who are unable or prefer not to take oral medications for extended periods. Finally, if the herniated disc condition cannot be effectively treated with the above methods, surgery may be considered as a last resort. Surgery can involve removing the damaged portion of the disc or replacing it with an artificial disc, helping to relieve pain and improve mobility for the patient. Herniated discs are not the end of the road. Early detection, proper treatment, will help you regain a healthy, pain-free life. Share this video if you found it helpful. Don't forget to hit like and subscribe so you never miss out on important health information from Health 999.